Hi, my name is Rita Hamad. I'm an associate professor at the Department of Social and Behavioral Sciences at the Harvard School of Public Health and the director of the Social Policies for Health Equity Research Center. Today, I'm going to be summarizing a paper that our team recently published in AJPH. The title is "The Pent-Up Demand for Breastfeeding Among U.S. Women, Trends After COVID-19 Shelter in Place." Before I start, I'd like to acknowledge my co-authors on this paper, Daniel Collin, Allison Gemmel, Caitlin Jackson, and Deb Karasek. We're also grateful to the funders of this study, shown here. I'm first going to give some background about breastfeeding practices in the US prior to the COVID-19 pandemic. I'm then going to describe our methods, including the data sources and analysis. Next, I'll summarize our results, which illustrate the trends in breastfeeding practices in the immediate aftermath of COVID-19 shelter-in-place policies in early 2020. And finally, I'll describe the implications for public health and policy. This first figure shows the percent of infants ever breastfed across the various countries in the Organization for Economic Cooperation and Development, or OECD. You can see that the US, in the red box, has among the lowest rates of breastfeeding initiation of any high-income country. As an aside, these data are from 2005. Harmonized data for all OECD countries in more recent years are not available, but the trends appear similar for the countries with available data. As with many aspects of health, these overall numbers mask even more disparities within the US. This next figure again shows the percent of infants ever breastfed, but this time broken down by poverty level. The lowest rates are among those with the lowest incomes, in orange, and we see a gradient of increased breastfeeding with increasing income. There are similar racial disparities with lower breastfeeding rates among Black and Native American women. It's important to be clear that these disparities are most likely driven by structural factors. In particular, the US is the only high-income country without a national paid leave policy for new parents. Moreover, lower income, Black, and other socioeconomically marginalized women are more likely to be employed in workplaces that don't have breastfeeding-friendly policies, and in particular, paid leave. That brings us to the research question for the present study. We sought to examine the trends in breastfeeding practices at the beginning of the COVID-19 pandemic, when shelter-in-place policies were in effect. These policies encouraged or required the vast majority of Americans, including new parents, to stay home during the spring of 2020. This created a natural experiment that helps us understand what would happen if the US did implement a national paid leave policy, in addition to illustrating trends in this important health outcome during the pandemic. To examine this question, we use data from the CDC's Pregnancy Risk Assessment Monitoring System, or PRAMS. PRAMS is a national survey sampled from birth certificates that includes most states in most years. For this study, we used the 2017 to 2020 waves, and our sample size was over 118,000 people. The breastfeeding practices we examined were whether the respondent ever breastfed her infant, and for those who did breastfeed, we also examined breastfeeding duration in weeks. We first tabulated and graphed trends in these two outcomes, contrasting the period before shelter-in-place with the period at the peak of shelter-in-place. We calculated the absolute and relative differences between these two periods. Our analysis used PRAM survey weights, and we also conducted subgroup analyses to examine disparities by race and ethnicity and income. We also conducted a more sophisticated analysis that I won't have the time to summarize here, which examined whether pre-COVID-19 trends were statistically significantly different from post-COVID-19 trends using a Bayesian structural time series approach. I encourage you to read the paper if you want to find out more about that. When plotting out breastfeeding trends in the overall sample, we found that there was no change in whether infants were ever breastfed over the course of 2020, which is the top line. However, there was a dramatic increase in the duration of breastfeeding from 12.6 weeks to 14.8 weeks at the peak, which is about a 17.5% increase. The time series analysis, not shown here, confirmed that the increase in breastfeeding duration was a statistically significant departure from pre-pandemic trends, and that this increase persisted through at least August 2020 before rates dropped to levels consistent with pre-pandemic trends. Breaking this out by race and ethnicity, we see that in most groups, the change in breastfeeding initiation was less than 1%, but there was a decrease among Black respondents of about 5%. For breastfeeding duration, there was variation in how much of an increase there was during shelter-in-place policies, although the lines are a bit overlapping in this figure. We saw the smallest increase among Hispanic respondents at 10.3%, and the largest increase among white respondents at 19%. Similarly, in subgroup analyses by income, there was no change in breastfeeding initiation among high-income groups, and a small decrease of 1.9% among low-income groups. And again, there were disparities in how much of an increase in breastfeeding duration we observed by income, with high-income respondents experiencing an 18.5% increase compared with a 16.8% increase among low-income respondents. To summarize public health implications, this study documents a discontinuous and substantial increase in breastfeeding duration nationwide at the beginning of the COVID-19 pandemic. Widespread shelter-in-place policies enabled parents who gave birth immediately before the policies to continue breastfeeding instead of returning to work. Gains were larger among white and high-income respondents, whose jobs could more easily be carried out at home. Gains were smallest among Hispanic respondents, who were more likely to be low-wage workers and disproportionately considered essential. And these already faced structural barriers, including lack of paid leave. Of note, there were no changes in breastfeeding initiation in the sample overall. This suggests that barriers to beginning breastfeeding may differ from barriers to continuing breastfeeding. Also, the larger decrease in breastfeeding initiation among Black and low-income participants may be due to decreased access to postpartum breastfeeding supports in the context of shelter-in-place policies. Future studies should examine whether trends and disparities were sustained into 2021 due to new societal norms or increased remote work during later phases of the pandemic. In terms of policy implications, this suggests a substantial pent-up demand for breastfeeding in the US, which may be stymied by the lack of a national paid family leave policy to support the health of parents and infants during the postpartum period. It suggests that rates of breastfeeding in the US would be higher and more comparable to peer countries if working parents were able to stay home with their infants. It also highlights the need for careful design of paid leave policies to ensure equitable access. Even in the absence of a national policy, state paid leave policies are also an active area of policymaking. Employers can also work to address these disparities through flexible remote work, lactation spaces, or other breastfeeding-friendly workplace policies. Thanks for listening, and feel free to read the full article on the AJPH website for more details. You can also check out our team's website to find out more about our research in this space.